If you are over 60 and you have ever noticed a strange pressure in your chest after walking, climbing stairs, carrying groceries, or even moving across a parking lot, you may have brushed it off as nothing serious. Most older adults do. They assume it is aging, poor fitness, stress, indigestion, maybe just getting tired more easily than they used to. But what worries cardiologists is that the heart often sends small warnings long before a major cardiac event happens. And one of the most commonly ignored warnings in seniors is chest pressure that appears during activity and improves with rest. That pattern matters because your heart is not supposed to struggle during basic movement. What makes this especially dangerous is that many older adults never experience the dramatic movie-style heart attack symptoms people expect. There may be no crushing pain, no sudden collapse. Sometimes the warning is subtle, a heavy feeling, tightness, burning, mild squeezing, pressure that spreads into the shoulder, jaw, upper back, or arms, or simply unusual exhaustion after walking short distances. And when people dismiss these signs for months or years, the next warning may come too late. I'm Dr. Raymond Hale. For more than 3 decades, I've treated older adults with heart disease, circulation problems, diabetes-related vascular damage, high blood pressure, and age-related cardiac decline. And I can tell you this with certainty. Many seniors who end up in emergency rooms first experienced small warning symptoms during everyday activities, but they waited. One patient I remember clearly was a 74-year-old grandfather named Leonard. He told me he had started stopping halfway through his evening walks because of pressure in the center of his chest. Not pain, just pressure and shortness of breath. He assumed he was slowing down with age. His wife noticed he had also become more fatigued after meals and avoided stairs whenever possible. He delayed getting checked for nearly 6 months. When testing was finally done, we discovered severe narrowing in multiple coronary arteries. One blockage was critical. He was very close to suffering a major heart attack. And this is why this conversation matters so much right now. As the body ages, arteries stiffen, circulation changes, inflammation builds slowly, and the heart becomes more vulnerable to oxygen shortages during physical activity. But the symptoms do not always appear dramatically. Sometimes the body whispers before it screams. In this video, I'm going to explain what chest pressure after walking may actually mean, why older adults often miss the danger, what is happening inside the arteries and heart muscle, and most importantly, what you should do to protect yourself before a serious event happens. Because understanding these early signals can save your independence, your mobility, and in some cases, your life. One of the biggest reasons seniors ignore chest pressure after walking is because the symptom does not match what they believe heart disease is supposed to feel like. Most people imagine a heart problem as sudden crushing pain that drops someone to the floor. But in real life, especially after 60, the body often gives quieter and more confusing signals first. Here's what many older adults assume is happening. They think the pressure is coming from getting older, being out of shape, eating too heavily, poor sleep, stress, or sore chest muscles. Some people even blame cold weather or anxiety. And while those things can affect how you feel, they do not explain why the symptom repeatedly appears during physical activity and improves with rest. That pattern is the clue. Now let me explain what may really be happening inside the body. Your heart is a muscle, and like every muscle, it needs oxygen-rich blood to function properly. That blood travels through small vessels called coronary arteries. Over many years, those arteries can slowly narrow because of cholesterol buildup, inflammation, high blood pressure, smoking history, diabetes, or aging-related vascular damage. Think of these arteries like water pipes in a home. When the pipes are clean, water flows easily. But when years of buildup narrow the inside space, pressure increases and flow becomes restricted. The same thing can happen inside the heart's blood supply. At rest, the heart may still receive enough oxygen to function normally, but during walking or climbing stairs, the heart suddenly demands more fuel and more oxygen. If narrowed arteries cannot deliver enough blood quickly enough, the heart muscle becomes temporarily stressed. That stress can create pressure, tightness, heaviness, breathlessness, or fatigue. This condition is often called angina, and here is the part many people miss. Angina is not the actual heart attack. It is often the warning before the heart attack. It is the body signaling that circulation to the heart muscle is becoming dangerously limited during activity. This is why symptoms that consistently appear during exertion should never be ignored, especially after 60. The body is giving you information before permanent damage occurs. And in the next chapter, I want to explain the first major mistake seniors make when these symptoms start appearing, because this mistake delays treatment for thousands of people every year. The first major mistake many older adults make is reducing their activity instead of investigating the symptom. This happens constantly. A person notices chest pressure during walks, so they shorten the walk. Then stairs become uncomfortable, so they avoid stairs. Then grocery shopping becomes exhausting, so they move more slowly or stay home more often. The symptom temporarily becomes less noticeable because the body is avoiding the trigger. But the underlying heart problem continues progressing silently. This is where the situation becomes dangerous. When physical activity decreases, circulation worsens, muscles weaken, blood sugar control often declines, and cardiovascular conditioning drops even further. The person may believe they are protecting themselves, when in reality, they are allowing the heart and blood vessels to become even more vulnerable. I have seen many seniors enter a cycle where reduced movement slowly steals their independence without them realizing it. And because the decline happens gradually, it feels normal. A patient once told me, "Doctor, I thought I was just slowing down." But when we reviewed his symptoms carefully, he had stopped gardening, stopped taking walks, stopped carrying laundry upstairs, and stopped visiting friends because activity triggered chest pressure and fatigue. His world became smaller because his circulation problem remained untreated. Now here is what is actually happening inside the body during this stage. When coronary arteries narrow further, the heart begins operating with less reserve capacity. During exertion, oxygen demand rises, but blood flow cannot keep up efficiently. The heart muscle responds with warning symptoms. In some cases, the electrical stability of the heart can also become affected, increasing the risk of dangerous rhythm disturbances. This is why symptoms during movement matter far more than symptoms at complete rest. The body is revealing how the cardiovascular system performs under stress. So what should you do if this sounds familiar? First, stop normalizing repeated chest pressure during activity. Second, pay attention to patterns. Does it appear during walking? After meals? In cold weather? During emotional stress? Does it improve with rest? Third, schedule medical evaluation sooner rather than later. Especially if you are over 60 and also have diabetes, high blood pressure, kidney disease, smoking history, high cholesterol, or family history of heart disease. Because the earlier reduced blood flow is identified, the more treatment options usually exist before permanent damage occurs. And what happens next is where the real risk begins, because many seniors experience warning signs that do not even feel like chest symptoms at all. One of the most overlooked truths in cardiology is that heart-related circulation problems do not always appear as obvious chest discomfort. In older adults, especially those with diabetes or long-standing vascular disease, the body's warning system can become altered. This is the part many people never hear about. Some seniors experience what we call silent or atypical symptoms. Instead of pain or pressure, they may notice shortness of breath, sudden fatigue, dizziness, nausea, upper back discomfort, jaw tightness, arm heaviness, or unusual weakness during walking. And because these symptoms seem unrelated to the heart, they are often ignored for months. Diabetes makes this even more concerning. Over time, elevated blood sugar damages nerves throughout the body, including nerves involved in pain signaling. Think of nerves like electrical wires carrying alarm messages from one area to another. When those wires become damaged, the signals may weaken or become distorted. That means some older adults with diabetes may develop severe heart circulation problems without classic pain. Instead, they simply feel tired, weak, sweaty, breathless, or unstable while walking. I once treated a woman in her late 70s who believed she was developing low energy from aging. Every time she walked through a large store, she became exhausted and slightly nauseated. She never felt chest pain. Testing later showed advanced coronary artery disease requiring urgent treatment. Her heart had been warning her for a long time. The signal just did not arrive in the way she expected. Now let me explain another important mechanism. As arteries stiffen with age, blood vessels lose some of their flexibility. Healthy arteries expand and adapt during increased activity. Stiffened arteries struggle to respond efficiently. That means circulation to the heart muscle may become limited faster during exertion. Inflammation also plays a role. Chronic inflammation acts like slow internal irritation, damaging the lining of blood vessels over time. This inner lining, called the endothelium, helps regulate circulation and vessel function. When damaged, blood flow becomes less efficient and plaque buildup becomes more likely. So what should older adults do? Do not wait for dramatic pain before taking symptoms seriously. If walking repeatedly triggers unusual fatigue, breathlessness, pressure, dizziness, or weakness, document it and seek evaluation, especially if symptoms improve after resting. Because in the next chapter, we need to discuss why ignoring these symptoms can eventually lead to sudden and life-changing consequences many seniors never see coming. Here's where the situation becomes far more serious. When chest pressure after walking is ignored long enough, the problem often moves beyond temporary circulation strain and into unstable heart disease territory. At this stage, plaques inside the arteries may become increasingly fragile. Blood flow becomes more restricted, oxygen delivery becomes less reliable, and the heart muscle operates under growing stress every single day. This is where major cardiac events begin to develop. Many people think heart attacks happen suddenly without warning. But very often the body has been sending signals for weeks, months, or even years beforehand. The signals were simply misunderstood. One reason this becomes dangerous after 70 is because aging changes how the body tolerates reduced blood flow. Recovery becomes slower. Blood vessels become less adaptable. Muscle mass decreases. Kidney function may decline. The brain may also receive less efficient circulation during cardiovascular stress. That means untreated heart disease can affect far more than the heart itself. It can increase fall risk from dizziness or weakness. It can worsen memory and concentration problems because the brain depends heavily on stable circulation. It can contribute to kidney stress because the kidneys require strong blood flow to filter properly. And it can slowly reduce mobility and independence. This is why some seniors suddenly seem to age rapidly after heart symptoms begin. The body is operating with reduced oxygen delivery. And here is another major concern. Sometimes the first severe event is not a heart attack. Sometimes it is heart failure. When the heart weakens over time from chronic strain and poor circulation, fluid can begin backing up into the lungs and legs. A person may notice swelling, breathlessness at night, sleeping upright, or exhaustion from simple activities. The condition develops gradually enough that people adapt to it without realizing how serious it has become. So what practical steps matter now? If you experience chest pressure or unusual symptoms during activity, do not test yourself repeatedly by pushing harder. Do not assume rest alone solves the problem. Do not wait for symptoms to become unbearable. And do not depend on internet guesses instead of proper medical evaluation. The earlier heart circulation problems are identified, the better the chance of preventing permanent heart muscle damage. Because next, I want to explain an overlooked daily factor that quietly worsens these symptoms in many older adults without them realizing it. One factor many seniors underestimate is how daily habits affect the heart's oxygen demand and circulation stability. Small routines can either reduce strain on the cardiovascular system or quietly increase risk over time. For example, heavy meals can temporarily redirect blood flow toward digestion, forcing the heart to work harder afterward. This is why some older adults notice chest pressure or fatigue after walking soon after eating. Dehydration is another hidden issue. As we age, the body's thirst signals become less reliable. Many seniors drink far less water than they need. Reduced hydration can lower blood volume, thicken circulation slightly, and force the heart to pump harder during activity. Poor sleep also matters more than most people realize. During deep sleep, the cardiovascular system performs important recovery work. Blood pressure regulation, inflammation control, and vascular repair all depend partly on healthy sleep patterns. Chronic sleep disruption increases strain on the heart over time, and medications can complicate the picture further. Certain medications may lower blood pressure too aggressively, alter heart rate responses, or interact with dehydration and heat exposure. That does not mean medications are bad. It means symptoms should always be reviewed carefully with a physician who understands the full picture. Now let me pause for a moment and ask you something important. If you are over 60 and you have ever noticed chest pressure, unusual shortness of breath, or fatigue while walking, write the word walking in the comments. And if you are caring for a parent or spouse dealing with these symptoms, let me know their age below. These conversations matter because many people suffer quietly for too long. Now here is the critical point. Symptoms often worsen gradually, not suddenly. That gradual progression tricks people into adapting instead of acting. But in the next chapter, I want to explain the warning signs that may suggest the condition is becoming unstable and potentially much more dangerous. There is an important difference between stable warning symptoms and unstable warning symptoms, and understanding that difference can save your life. Stable symptoms usually follow a predictable pattern. For example, chest pressure appears after climbing stairs and improves within a few minutes of rest. While that still requires medical attention, the pattern remains relatively consistent. But unstable symptoms are different. This is where the danger escalates sharply. If chest pressure starts appearing with less activity than before, lasts longer, feels more intense, or begins occurring even at rest, that may suggest blood flow to the heart has become critically compromised. And this is not something older adults should monitor casually at home. Another warning sign is symptoms occurring during the night or early morning. Changes in blood pressure, stress hormones, circulation patterns, and oxygen demand during these hours can sometimes trigger serious cardiac events. Sudden sweating, nausea, jaw discomfort, arm heaviness, unusual weakness, or breathlessness accompanying chest pressure should also never be ignored, especially after 70. Women may experience even subtler symptoms. Instead of classic chest pressure, some women describe exhaustion, upper back tightness, dizziness, nausea, or overwhelming fatigue during ordinary activity. This difference has caused many women's symptoms to be dismissed or misinterpreted for years. And here is where diabetes and kidney disease create additional danger. Both conditions accelerate blood vessel damage. High blood sugar acts almost like microscopic corrosion inside circulation pathways over time. Kidney disease also increases vascular stiffness and inflammation. Together, these conditions can dramatically raise the risk of heart complications while simultaneously masking warning symptoms. That combination is extremely dangerous. I have seen patients arrive in emergency departments after weeks of mild symptoms that turned out to be advanced coronary disease requiring urgent intervention. The body often gives earlier warnings than people realize. So if symptoms are increasing, changing pattern, appearing at rest, or spreading into the jaw, arms, neck, or back, do not delay care. Call emergency services immediately if symptoms become severe, persistent, or associated with fainting, confusion, or difficulty breathing. Because before I show you exactly what older adults should start doing this week to protect themselves, there is one more overlooked factor you need to understand first. One overlooked factor is emotional stress. Many older adults separate emotional strain from physical heart symptoms, but the cardiovascular system does not separate them so neatly. Stress hormones increase heart rate, raise blood pressure, tighten blood vessels, and increase oxygen demand on the heart muscle. For someone with narrowed coronary arteries, emotional stress can become the extra burden that exposes an underlying circulation problem. This is why some seniors notice symptoms during arguments, anxiety, grief, financial stress, or caregiving exhaustion. The heart responds to emotional pressure physically. Loneliness and isolation also matter more than people realize. Reduced activity, depression, disrupted sleep, poor eating habits, and chronic stress can quietly worsen cardiovascular health over time. Now, this does not mean every episode of stress causes a heart attack. But it does mean repeated symptoms during emotional strain deserve attention instead of dismissal. And there is another overlooked issue. Many older adults normalize exhaustion because everyone around them is aging too. They compare themselves only to peers experiencing similar decline. But becoming severely winded walking short distances is not something you should automatically accept as normal aging. Healthy aging still allows movement, recovery, and reasonable endurance. So pay attention to changes. Changes matter more than age alone. If you walked comfortably 6 months ago, but now develop pressure, fatigue, or breathlessness doing the same activity, your body is telling you something important. And now we reach the most practical part of this discussion. In the next chapter, I'm going to walk you through exactly what you should do today, tonight, and this week if you have noticed these symptoms in yourself or someone you love. If you have experienced chest pressure, tightness, unusual fatigue, or breathlessness during walking, the first thing I want you to understand is this. Do not panic, but do not ignore it either. The goal is not fear. The goal is early action. First, start paying close attention to symptom patterns. Notice when the symptoms occur. During stairs, after meals, in cold weather, during stress, while carrying objects. How long do they last? Do they improve with rest? Write these details down. That information helps physicians identify important patterns much faster. Second, schedule a medical evaluation promptly, especially if you are over 60 and have risk factors like diabetes, high blood pressure, high cholesterol, kidney disease, smoking history, sleep apnea, obesity, or family history of cardiovascular disease. Testing may include blood pressure evaluation, heart rhythm assessment, stress testing, imaging, or circulation studies depending on your symptoms and medical history. Now, here is something important many people misunderstand. Getting evaluated early does not automatically mean surgery or a catastrophic diagnosis. Sometimes symptoms are caught at a stage where medication adjustments, lifestyle improvements, circulation management, and careful monitoring can significantly reduce risk. Early awareness creates options. Waiting reduces options. Third, protect your heart daily while awaiting evaluation. Avoid sudden overexertion. Stay hydrated unless your doctor has placed fluid restrictions on you. Take medications exactly as prescribed. Prioritize consistent sleep. Control blood sugar carefully if you have diabetes. And pay attention to recovery after activity. A healthy cardiovascular system should recover reasonably well after mild exertion. Fourth, no emergency warning signs. If chest pressure becomes severe, lasts more than several minutes, appears suddenly at rest, or occurs with fainting, severe shortness of breath, confusion, nausea, or pain spreading into the jaw or arm, seek emergency care immediately. Do not drive yourself if symptoms are severe. Now let me say something directly to caregivers and family members. If your parent, spouse, or loved one has started avoiding activity, slowing down dramatically, stopping frequently during walks, or complaining about chest heaviness, take it seriously even if they minimize it. Many older adults hide symptoms because they fear losing independence. But early treatment often protects independence rather than taking it away. And in this final chapter, I want to leave you with the most important message of all, because this conversation is ultimately about preserving your future, not frightening you. The most important thing I want you to remember is this. Your body usually gives warning signs before a major cardiac event happens. The problem is that many older adults have spent years being taught to ignore discomfort, push through symptoms, or blame everything on aging. But healthy aging and dangerous decline are not the same thing. Chest pressure after walking is not something you should quietly normalize, especially if it appears repeatedly or worsens over time. The heart is remarkably resilient, but it depends on one thing above all else: reliable blood flow. When circulation to the heart begins failing, the body often sends smaller signals first. Fatigue, tightness, breathlessness, pressure during activity, reduced endurance, slower recovery. These are not random inconveniences. They are information. And when you respond early, you give yourself the best possible chance to protect your mobility, your independence, your memory, your energy, and your quality of life. I have seen patients completely change their outcomes simply because they acted when symptoms were still manageable instead of waiting for a crisis. That is the real purpose of videos like this, not fear, awareness. Because awareness creates action, and action creates protection. So here is one simple thing I want you to do tonight. Think honestly about whether your physical abilities have changed recently. Are you avoiding stairs more often? Stopping during walks? Feeling pressure or unusual fatigue after mild activity? Becoming breathless more easily? Do not judge yourself for those changes, but do not ignore them either. Talk to your doctor. Get evaluated. Ask questions. Pay attention to your body while there is still time to act early. And if you know someone over 60 who constantly says, "I'm probably just getting older," while showing these symptoms, share this video with them. It may help them recognize a warning sign they have been dismissing for far too long. And if you want more medically grounded information designed specifically for older adults, focused on heart health, circulation, blood sugar, stroke prevention, mobility, memory, and healthy aging, subscribe to the channel and stay connected. There is still so much you can do to protect your health after 60, after 70, and even after 80. Thank you for spending this time with me today. Please take care of yourself, listen carefully to your body, and I will see you in the next video.